Sanitize your hands before you begin. Assemble the appropriate equipment. This includes the soaking solution ordered by the physician, the bath thermometer, the basin, and the bath towel. Check the label on the solution container to make sure you have the correct solution as ordered by the physician. Warm the soaking solution by placing the solution containers in a basin of warm water. The solution should be warmed to 105 to 110 degrees Fahrenheit, which is 41 to 44 degrees Celsius. Greet your patient and introduce yourself.
Hello, my name's David.
Identify your patient and explain the procedure and the purpose of the application. Mary sprained her left ankle 3 days ago. Initially, ice was applied to her ankle to prevent swelling. Now the physician wants the medical assistant to apply a hot soak to Mary's ankle for 20 minutes. The purpose of the soak is to relieve pain and promote healing. The medical assistant must also instruct Mary in the procedure for applying a hot soak at home. To prepare for the procedure, fill the basin 1/3 to 2/3 full with the warmed soaking solution. Check the temperature of the solution with a bath thermometer to make sure it is between 105 and 110 degrees Fahrenheit. Assist the patient into a comfortable position to avoid fatigue and muscle strain. Pad the side of the basin with a towel for the patient's comfort. Slowly and gradually immerse the patient's affected body part into the solution. Ask the patient how the temperature feels. The affected body part should become accustomed to the change in temperature gradually. Test the temperature of the solution frequently. To keep the temperature at a constant temperature, remove cooler fluid every 5 minutes and replace it with hotter solution. Pour the hotter solution in near the edge of the basin by placing your hand between the patient and the solution. This will prevent splashing hot fluid on the patient. Stir the solution with your hand as you pour to help distribute the heat and keep the temperature constant. Apply the hot soak for the proper length of time as designated by the physician. Check the patient's skin periodically for signs of an increase or decrease in redness or swelling, and make sure to ask the patient if the site is painful. Completely and gently dry the affected part. Sanitize your hands. Review the instructions with the patient for applying the hot soak at home. Check to make sure the patient understands how to do this. Provide the patient with written instructions to take home. Ask the patient to sign the instruction sheet and witness her signature. Sign the instruction sheet with your name and date. Chart the procedure. Include the following information: date and time, method of heat application, which is a hot soak, name and strength of the solution, temperature of the soak, location and duration of the application, appearance of the application site, and the patient's reaction. Also, chart the verbal and written instructions you provided to the patient for applying a hot soak at home. Make a copy of the instruction sheet to give to the patient. File the original in the patient's chart. Properly care for the equipment and return it to its storage location.